Hello, I'm going to go through the top 10 list of health and travel related information that you should have. And I'm going to start with International SOS. You can't hear this enough. They have helped so many people out of medical problems. I always recommend people download the app. When I give talks to students, I make them download the app while I'm there, just so that way you have it convenient. You don't have to go searching for numbers and stuff like that. If any MIT person contacts them and if it turns out to be a medical related issue, they actually inform me. They send a summary of what's going on. And that way I can manage if somebody is going to need continuing care after they get back. We help to coordinate it and everything is ready when they get back. As Todd said, just an incredible, incredible resource. Another site that everybody should be familiar with, our website, is the CDC travel site. It's very user-friendly. They have separate sections for clinicians, a separate one for non-clinicians, and you just click on the country. It tells you exactly what types of infections are there, what type of immunizations you might need. For malaria, some of the other sites, they just say, yes, there's malaria in the country, but if you go to this CDC site, you can click on a map that actually shows you which areas of the country have malaria. So not everybody who goes to South Africa needs malaria medications. You look to see exactly where the person is going. But you can figure this out yourself, especially if you're a seasoned traveler. Go to the site, figure it out. You look at your immunization record, and a lot of seasoned travelers can figure out what they need. If not, then we have our travel clinic. And over the years, we have tried to make it as user-friendly as possible. In traditional travel clinics, and there are a dozen in town, there's one at Mount Auburn Hospital, MGH, Logan Airport has one, Beth Israel has one. They're all over the place because at a lot of hospitals, they're kind of the cash cow. People come in and they pay a lot of money for a consult and overhead for the vaccines and stuff like that. At MIT, what we've tried over the years is to minimize the need for people to take time out of their life and come in and sit there and hear us talk about travelers' diarrhea for the 8th time. So for the seasoned traveler, we set up a process. You can go online and just either make an appointment or give your travel information, and then our travel nurse will look through your record, see whether you're up to date with immunizations or if you need any boosters. If you've been through the malaria stuff before, she'll just order the malaria medications for you at whatever pharmacy you want and expedite it. 90% of our travel consults now are done remotely. Only about 10% of people need to actually physically come in. And we do that for people if either it's their first time traveling and they have complicated medical problems or stuff like that, then we want to see them in person and do more counseling and questions. But it's a great resource. You can go there, or you certainly are welcome to go to one of the other ones in town if your insurance covers it. The immunizations that we focus on are hepatitis A, typhoid, polio, things that you would not necessarily need for travel in the United States, but that are commonly seen in some other countries. We use the opportunity, though, to update you on other things. You know, if you're overdue for your tetanus booster, we'll give you that. We give flu shot, or we recommend flu vaccine for everyone who's traveling. So if you haven't had it, that's an opportunity to get it. So it's just a general review of immunizations. We also review mosquito and tick precautions because in a lot of the areas of the world, there are mosquito or tick-borne infections, malaria, dengue, Zika, chikungunya, a long, 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 long list. And so it's an opportunity to remind people you can get this information at the CDC website, but a lot of people sort of skim over it. Zika is one that is particularly important for people who are in childbearing years, for women and for men, because it can be sexually transmitted. So that's one of the questions that we ask if somebody's traveling, and then we give them extra counseling about Zika. They can get this all online, but if they interface with us, we just make sure that they're aware of it. One thing that keeps coming up is the issue about how responsible are you for preparing your travelers, whether they're students or faculty. How responsible are you for preparing them for the trip? And Todd and I keep preaching to anybody who will listen about this case that was just settled a few months ago of a student at a prep school, a high school, where she went on a school-related trip to China and ended up getting a tick-borne disease called tick-borne encephalitis and ended up with permanent brain damage. And her prep school just had to settle $47 million because the appeals court did agree that it was the school's responsibility to prepare the person for travel. We haven't had anything like that at MIT. But in terms of preparation for travel, sharing this information, if you have somebody traveling and you tell them, go to the CDC website and read everything on that website, that's as minimal of preparing that you can do for someone. Traveler's diarrhea, most people who travel get diarrhea. It's not necessarily anything bad like salmonella. Sometimes just the change in the food that you're eating, the change in the water elements can cause diarrhea. When people from France come to the United States, they get diarrhea. It's just the changes in the food. It's not necessarily going to a developing country or a poor country. But we do talk to people about the diarrhea. Over the last many years, we've been trying to reduce the inappropriate use of antibiotics. So there was a point where everybody was given a packet of Cipro, a few Cipro tablets. If you get diarrhea, take it. And we would emphasize only take it if you've got severe diarrhea, meaning blood in the stool, high fevers. For that, you take Cipro. Otherwise, just take some Imodium and keep yourself hydrated and you'll be fine. And what happens is that everybody, they're on vacation or a work-related trip, and first sign of diarrhea, they start popping the Cipro. So we end up seeing a lot of people taking it inappropriately and then ending up with the complications of Cipro, of which there are many. So nowadays, we actually don't give Cipro to everyone. We emphasize the rehydration salts and things like that. If you're going to bring anything, bring a packet of rehydration salts, because you may not be able to find Gatorade where you're going to. But keep yourself hydrated, bring some Imodium to slow up the diarrhea, but we don't give the antibiotics as readily. We feel that if somebody is that sick, if they are having high fevers, if they are having blood in the stool, get medical care. Call ISOS and they will direct you somewhere. In a lot of countries, you can go into the pharmacy and the pharmacist will give you antibiotics. But we just don't like people carrying it around, then they come home and the Cipro's in the cabinet, and then next time they get a sore throat, they take the Cipro. And so anyway. Planning for any chronic medical or mental health condition is really vital, and we try to emphasize that. People who've had asthma, it's been stable for years, I haven't used my inhaler in 7 years, and you're going to Beijing and you breathe the pollution, your asthma gets triggered. People with more severe medical problems like ulcerative colitis or Crohn's disease, and they've been getting their infusions every 8 weeks, and they're going now away on a 10-week trip. What are you going to do? So we just encourage people to plan, speak to your doctor, your nurse practitioner, and plan for what are you going to do. If you have an old inhaler, get a new inhaler. The important thing is planning so you don't end up sick and not knowing what to do when you're away. Mental health also. Right now, mental health problems are the #1 reason for students needing to be repatriated and brought back from the country they're at. So for people who have ongoing mental health problems, it's important for them to talk with their therapist, their doctor, about planning for what do you do when you start getting lonely? What do you do when you start X? Do you call your therapist here? What do you do? ISOS can help out with that also. But the critical thing is planning for what are you going to do if your condition becomes unstable. Access to funds, International SOS will facilitate things, but they're not an insurance company. They are an emergency assistance provider. Our insurance, Blue Cross, the MIT insurance, does cover emergencies that happen abroad, but if you show up in an emergency room, you've got to somehow prove to them that you can pay $10,000. It's not like the United States where you just sign a waiver and they'll bill the insurance, and if the insurance doesn't pay, then they'll bill you. When you're a visitor in a country, they want to make sure they get the cash. So they require that you either hand over the cash or give them a credit card with a credit line. So when you have people who are traveling, make sure that they know which credit card they're going to use or how they're going to very, very quickly access that credit line. Blue Card Worldwide, for those who have Blue Cross, which is the MIT insurance, they have a network of hospitals all over the globe with which they have contracts, doctors and hospitals. And if you go to one of the Blue Card Worldwide hospitals or doctors, they can bill Blue Cross directly. Otherwise, you have to pay out the money. If it's the hospital, you pay out whatever they're charging, and then you get reimbursed when you get back. But if it's a Blue Cross hospital, they'll be able to charge Blue Cross directly. And lastly, just want to tell you about International SOS. Those are like 2 of the top 10 things to know. If you have to leave with one bit of information, that's it.